This is a retrospective study in which we reviewed the medical records of almost 3,000 patients with AL amyloidosis who were diagnosed with this disease in the past 15, 16 years, from 2004 to 2018. This is a collaborative project. Many different centers from 10, 11 different European countries provided their data for these patients. And we were able to see the trends in the treatment of this disease during the course of this past 15, 16 years. For example, it was very interesting to see how we moved from chemotherapy to bortezomib-based therapies, which seems that today is the most commonly used treatments. Also, we were able to see what is the use of autologous transplantation and what was the use of treatments at the time of relapse. So, because some of the patients, of course, they have hematologic relapse or organ progression and they need salvage therapy. So in this regard, we saw, for example, that as we move with the use of bortezomib from to first line, we have less patients who are using bortezomib for salvage therapy at the second line. About 1/3 of the patients at the second line, they received IMiDs, mostly lenalidomide or pomalidomide. And also in the past 2 years, we have seen some use of daratumumab. We were also able to observe that there was a significant improvement in the response rates, in the hematologic response rates, as we moved towards the use of bortezomib-based regimens. However, this improvement was not seen in patients with more advanced disease, such as patients with stage 3B disease. These improvements in the hematologic response rates were associated with some improvement also in the overall survival of patients with stage 2 and stage 3A disease. Patients with stage 1 disease had rather similar overall survival across these time periods and with different primary therapies. These are the patients, of course, who have generally better prognosis. What was very disappointing is the fact that patients with stage 3B disease, with more advanced disease, did not seem to have any significant benefit over the last years that we have moved to new therapies. And also it was very disappointing to see that in general, we still delay in the diagnosis of these patients, and the proportion of patients who present with very advanced disease and have very poor prognosis remains the same.